Hey, good afternoon, everybody. This is Eric with American Business Systems. I want to welcome you to our Wednesday webinar. Today, we're going to be talking about our training program and why it's better, we believe, than any others that are out there in the market. So I hope that you're ready to attend today and ask some questions. And I appreciate you joining me here already. Got some folks that are coming in. Some of you were already here before we even got started, so I appreciate you being early. But we always like to give some folks just a little bit of time this afternoon. But if you've been on any of my webinars or any of the ABS webinars before, you know that we like to use the Q&A box. So if you'll find that Q&A box there and you'll just type in where you're calling in from, that would be so helpful. I would appreciate that. And then we will get started. Chad, it's good to see you again out of Kentucky. Good to see you. Let's see that Alyssa's coming in and Gandhar. I hope I said your name correctly. And Olasingan said your name correctly. Latanya's coming in. We got folks from Corpus Christi here. So it's good to see everybody this afternoon. Folks, we're going to just do a little deep dive on the training program. And the last time we did one of these was early January. So, here we are and starting the second quarter of the year. If y'all can believe this, we're already in the middle of April, well into the second quarter here. We thought we would review this again because, folks, this is the heart of what makes you do what you do. And it prepares you for your success. Training with anything, whether it's you're starting a new job or you're learning a new skill, training is the heartbeat of succeeding. And so what we're going to be doing today, we're going to be reviewing pretty much in detail some of the things that you're going to learn during the training course. And what you to expect, and then how you're going to get the training, and we're just hopefully answer a lot of questions there. So, Tanya, it's good to see you again from Gary, Indiana. So good, thank you. For all the rest of those, please don't be shy. Put in your location of where you're located today in the Q&A box, and then at least you know from there where to ask me some questions as we go through this. Well, folks. All right, we're already 2 minutes after the top of the hour, so let's just get started here. Again, for some of you that are first-time joiners for us here at American Business Systems, I usually always do a little bit of an introduction to let you know who we are at American Business Systems, who you're talking to here, and then for some of the other things that ABS brings you to the table here. So my name is Eric Auger. I'm the Director of Learning and Engagement here. Obviously, I'm here to help you learn a little bit about who we are. That's extra of what you're getting from your sales rep here at American Business Systems. So you may have seen me on some other webinars and some there in the past. If you can't hear us or anything, you'll please want to make sure you're turning up your speakers. Just say hello using the Q&A box there, or just like I said, let me know where you're calling in from this afternoon. Adam Phillips is our CEO of American Business Systems. Adam's been very busy. He's got some new things that have come out for him and for American Business Systems. He is a publisher in a magazine called Billing and Coding Advantage Magazine, where he's got a couple of articles that are there that you might be interested in. Now, if you want to take a quick screenshot of this and just save it for a little bit later, you can get these as a PDF from the sales rep that you're working with here at American Business Systems. So this one on why the shrinking private practice, why billing expertise can be a lifeline, and basically it's a lifeline to these doctors. Also, he's written one on artificial intelligence and why for us it's more of an advantage than anything else. And I think you're going to find that as time goes on, that it's actually helping doctors do billing better, which will help you make sure that you get everything you can for those doctors. Dr. Vicki Rackner joined Adam in writing a book called 9 Ways Doctors Let Money Slip Through Their Fingers. This is a great little book. You can find it on Amazon. But again, for those that are on here today, I'm just going to let you know if you'd like to get a copy of this, go ask your sales rep for a PDF copy of this. We would love to send that to you. So this is my gift to you for being on the webinar this afternoon. Also, Adam is the founder of an organization called MIRMA. MIRMA is an association with American Business Systems. They are the ones that do all the training and the certification. And they are once you finish the training here and you're starting to start your business here, you'll be part of one of the nation's largest group of independent medical billers in the country. So MIRMA is one of those organizations there. And again, as I said, that MIRMA is the one that will certify you again as a certified medical revenue manager. So keep all of that in mind as you're going through that, because so many people ask about the training. What am I going to learn about billing? What am I going to learn about coding? Am I going to become a certified coder? Am I becoming a certified medical biller? Folks, what you're getting out of this training to be a certified medical revenue manager is you're getting everything that I talked about, plus you're learning how to run your business also. So you're getting a lot of that, and we'll explain that a little bit here. Also, I wanted to let you know that one of our platforms that we utilize for our iClaim platform is a company called NextGen. Just to let you know that NextGen has been ranked as one of the number one in reports for a group called the Black Book Market Research. That's pretty impressive there. So we feel like we've got, we feel like we have the top ranked practice management solution on the market that is white labeled for you for iClaim for you to provide your services to your doctor. So if you got any questions about that, feel free to reach out to your sales rep. All right. Very good. All right, let's just get started here. We're already a little bit past the hour here, and I love just to jump right on in. Now, again, everybody should know where the Q&A box is. I'm going to erase some of these folks here so I can make sure that I can get directly to it. The approach of what I'm going to share with you today, some of this is going to be education. It's almost like an introduction of one of the first lessons that we teach here at American Business Systems. Folks, I think we can't give you enough information on these webinars. So, part of it is you've got to understand what you're doing and what is a certified medical revenue manager all about. So with that, I'm going to lay out some very basic things about medical billing, or what we call the revenue cycle management cycle, okay? So some of you may have seen this in the past. You may have seen it as you're doing some research in the past. But I'm going to just start right here, because if you'll take some notes here, you'll find out that there are 5 sections of revenue cycle management. This is what you're going to be doing once you've got a client. So we're not dealing with how we help you get clients today. We're talking about how the work is done today. We're talking about, what is revenue cycle management and how does that apply to you in your daily activities, okay? So the first thing that you will always going to start doing with revenue cycle management, you want to take notes here. Again, this is a great way to start taking notes. Or again, if through the presentation you want to take screenshots, you can certainly do that. No, so number 1 here is data collections. This is really where revenue cycle management begins. I can tell you that a lot of claims are rejected because patient registration is not done correctly. You get the wrong information about the patient inside of any practice management system. No matter how good it is, no matter how good that a sales rep might tell you that their practice management system and billing system is the best, if you got wrong data in there, it's still not going to work. Now, the exciting thing about our iClaim system, and again, if you haven't seen this in a demonstration with your sales rep, I certainly encourage you to get that scheduled out here as soon as possible, because understanding how this process works is really, really the game changer here, okay? So whenever I'm talking about patient registration, when you go to the doctor, they always ask you for your driver's license and your insurance card, because they're going to put that information into the system. Now, one slight mischaracter typed in there, the whole thing is shot at that beginning. The spelling of your name, first or last, the wrong date on the date of birth, a missed number or alphabet number, or a letter that's in your insurance line there, can just throw the whole thing off. And it's like one of those things that you don't know until after you process the claim, that the claim comes back rejected and they say they can't find the patient. So one of the highlighted things about the iClaim system, and with the advancement of artificial intelligence, we can actually type in, make sure that when we get the insurance card, we can literally type in this information into iClaim without putting name or anything else in there, and then research that. Well, you got to put the name and date of birth and their insurance information, but it's going to do a search. And let's say it's going to Blue Cross Blue Shield or to Medicare or Aetna. Well, our system will go there and check to see if that patient is eligible to receive their health care benefits. If they are, this is the beauty of it. By one more click of a button, we can create an entire patient demographics in there. So when you see data collections, number one, folks, if this is missing here, 2, 3, 4, and 5 don't even matter, because it'll get to the claim gets process, and actually this is again where a lot of doctors lose money. And then the claims preparation, and then I'm going to get with you on claims preparation here in just a moment. That this is just how that it just simply works here. All right, number 2, let's get into number 2 here. This is actually the claim submission. Claim submission. So let me pull this up there. Claim submissions is coding edits, procedural and diagnosis entry. I'm going to share that with you here in a moment, what I'm talking about there. So this is where we kind of get into the codes, the medical codes. And I know a lot of you might be a little, I wouldn't say afraid, but just unknowing about medical codes. I'm sure people have said, hey, you're going to get into medical billing. Don't you know that there's hundreds and thousands of codes and they change all the time? They do. However, again, within our system, and you'll find out that we have all of the updated codes. We have everything that's needed through there. So don't worry about that. I'm going to kind of lead you through that. Number 3. This is where claims management happens. This is where we get into the actual claims management of the claims. Did they get submitted? Did we get what's called an ERA, electronic remittance advice? This is basically saying, the doctor used these codes, and this is what is supposed to be reimbursed. This is maybe where some adjustments are going to be made, some things that go along with the patient responsibility. Was this claim submission through electronic? Did it have to do with paper? Then starting to that's that best part of it, payment postings. That's whenever you start to see how much you've actually started to collect for the doctors, because this will eventually lead you to what you're going to be charging the doctor for your services. So that's number 3. Number 4 is AR follow-up. So obviously any accounts receivables follow-up. This is where you're going to get into possibly some secondary claims. So everybody has heard this. You got a primary insurance and you got a secondary insurance. So before you can bill the secondary insurance, you have to get the primary done. So once the primary pays, then you can go back and do the secondary claim. And again, that's just more money coming in. Now, again, using our system, our doctors are getting paid within 7 to 10 days. So within about 2 weeks, you get everything done, the primary and then the secondary claim out the door. If there are any denied claims, this is where you're going to rework those claims and get those claims resubmitted. So it kind of goes back through the whole follow-up there. And if there's any appeals, sometimes you've got to make an appeal that, the doctor did have all of their notes in there. And so sometimes we call it, fighting for the doctor's money, but you're going to make an appeal ever so often. So this is the AR follow-up, because remember, you want to make sure that doctor's collecting as much money as possible. So this is the whole process there. And then finally, when we get to number 5, this is the reporting part. This is where you get to report everything you've helped that doctor collect. Then you can see the whole cycle just repeats itself. So this will be something that you're doing day in and day out. You at one part of the day, you're doing one of these steps through there throughout the day, because what you did on the beginning part of the month, you've done your data collections, you've done your claim submissions. It takes 7 to 10 days to start going through that. Then you start doing your claims management. But then on day 2 of the month, you're putting in patient information, Well, actually, the doctor's office is doing that, and I'll show you how all that's done here. But processing the claims, you're doing that, and so this cycle is going to just keep going on and on and on and on. Okay. All right. Any questions about this so far off this first slide here? Okay. If not, I'm going to move on. Feel free again at any time during the presentation, whether I'm stopping you to ask you if you got any questions. Feel free just to pop in a question. If I feel like I can answer it right then, I'll certainly do it. If not, we'll catch it on the back end. Okay. All right. Let's talk about medical billing basics. There are two types of people out there. There are medical coders and then there's medical billers. And so, just to kind of give you a basic definition, because a lot of people want to know when you're getting involved with American business systems, am I going to be a coder? You're not going to be as a coder because typically to be a coder or even what's called as a certified professional coder, a CPC, usually is about 2 years of schooling to learn that. And then there's even some apprenticeship that needs to go through to get your finalization of all that. Now, don't let that freak you out that you can't do this because, again, I'm going to share with you who is really responsible for the medical codes. Now, some doctors need a medical coder because they're not charting it themselves. That means the doctors are not writing down the actual codes of what they just did when they got through with a particular visit with a patient. Matter of fact, I went to the doctor yesterday before I even walked out of the office. The whole claim was ready to go because the doctor had already put in all the claims, the basic codes that he needed to see me and get that turned into his biller. So he doesn't have a coder. I think he's got a biller in his office, but that's just what it is. But typically, a medical coder is needed for someone like a surgeon who they'll have, they're recording it, then they have to listen to it, it has to get transcribed, then that coder is really doing all the digging. Now, are there still needs for coders? Yeah, absolutely. Matter of fact, we have a service that actually will utilize certified professional coders called CodeWrite. That's one of your services. So if a doctor, when you're out there marketing, you're talking about your business, if they say, hey, LaTanya, do you have a coder? You can say, absolutely. That's part of one of my services. It's called CodeWrite, which is separate from medical billing. There's additional fees for that, doctor. But yes, we have coders because we've got that covered as well. Then a medical biller. A medical biller will just basically take now the alphanumerical codes that are there, and these are the codes that the doctors have already inputted, or if in a case of a surgeon and it goes to a medical coder, they get it. So a coder and a biller are two separate types of people. Billers are dealing with the money. Coders are dealing with medical notes and then charting all those things out, and then finally getting it out to what's called a medical code. Okay. Any questions so far about this? Just want to make sure that everybody understands the difference between a coder and a biller. You're not a coder. You will be a medical revenue manager, which will do medical billing. Okay, I'll say that again. You're not going to be graduating out of here as a coder. You won't need it. You don't need to be a coder. We've got that as a backup, but it's also within our software. But you will be a certified medical revenue manager that does medical billing. Okay, so you're going to be taking what this next slide is all about. You're going to be taking the two codes that a doctor will see a patient on. The first code is always called the diagnosis code. This is what's wrong with the patient. Yesterday I went in for an annual physical. So there wasn't really anything wrong with me, but the diagnosis was, this is my annual checkup. Okay, so this is what this is all about. So did he listen to my heart? Did he take my pulse? Did he take my blood pressure? Did they take my temperature? My oxygen levels, all of that. That's all part of what's called this SOAP note, some subjective and objective information. But all of that concludes in what is the medical condition of the patient. Okay, so does he have a cough? Does he have pain? Does he have an ingrown toenail? Or is there something more serious that the doctor's having to deal with? So whatever the diagnosis of the patient is part of the diagnosis codes, okay? Now, the procedure codes is what comes next. This is what the doctor actually has done or did to take care of the patient. The procedures is he did a physical exam on me. That's a procedure. Again, he reviewed past medical history. That's a procedure. There was no, thankfully, there were no injections that I had to get yesterday or anything else to take off or, debride a toenail or something like that. But those would be in-office procedures, okay? Now, there can be multiple diagnoses because, most everybody in America has hypertension. So that would be a diagnosis, and annual wellness visit, that's a diagnosis. And, whatever else may be, become a diagnosis. And then the actual visit becomes the procedure, 99212, 213, 214, 215. Okay. I'm an established patient with him. So those are just some of the procedure codes. And then he may add one or two more because he went into a little bit extra discussion with me on some other things. Okay. So there's two codes, two types of codes. One's a diagnosis code. You have to have a diagnosis code before you can do anything. And then you have to have a procedure code. Now, the procedure code, again, is sort of where the money is. This is where it's tied to how much the doctor is going to get reimbursed. However, as a certified medical revenue manager, and if you listen to any of the testimonials of any of our business owners that is currently doing medical billing, this is what they'll tell you. It is the doctor's responsibility to provide the medical codes to the medical billing company. Okay. That's why I'm telling you, you don't necessarily need to know the codes. Now, will you learn the codes? You'll absolutely learn the codes over a period of time. You'll know that a hypertension diagnosis is whatever it might be, a little bit being overweight, that might be a diagnosis, whatever that code may be. And so there's so many different codes to what's wrong with the patient. And then what the procedure is. What's the typical procedures for that particular doctor? Is he a regular family practice and internal medicine doc? They're going to probably be seeing the same thing. Whenever it's flu season, you're going to have more flu diagnoses and procedure codes. Whenever it's during the summertime and it's everybody's got sinus issues, it's going to be something to do along with those. So it's seasonal. Those things will kind of come and go as you'll see through the year. But once you've started doing billing for a doctor for 2 or 3 months, you're going to find out that they're only using a handful of procedures, diagnosis codes and procedure codes anyway. And it's just going to be so easy for you to start learning that. However, again, let me share this with you. If you've got a doctor that needs full medical billing coding, okay, we've got CodeWrite. CodeWrite is one of your auxiliary services here. So again, the right answer to every question that the doctor asks you is the word yes. Yes, we do that because I promise you, there is all of our ancillary services that we have here at American Business Systems will certainly cause you to say yes if the doctors ask that, because it is full of certified professional coders that can be there to help assist you. Let's say that the doctor says, you know what, I need to, I got these medical notes from the doctor. I don't know how to do it. So, okay, run it through there. So Chad was just asking, what is CodeWrite's charge? It's different. It's tiered level. I don't have what those tiered are, but anything that's you charge, I'll put it this way, Chad, it's built to where it's a wholesale price for you to charge retail. So it's enough to get that covered, and a lot of times just taken care of. And then there's a little bit of upcharge you can make it, but really you're going to be making the money on the actual processing the claim. The way that I did it, and folks, nobody's asked yet, but have I done medical billing? Yes, I've had 2 medical billing companies through ABS. And what I did with mine, many times I just built it into my percentage. I knew that somewhat during the month, there may be an opportunity for me to use CodeWrite. It's not expensive. I just built it in and just charged them a little bit on top of that for the actual additional service. So Chad, thanks for the thumbs up there. I appreciate it. And folks, there are the little icons there, the thumbs, the hearts. If I've answered your question properly, you can just give me a thumbs up or a heart and let me know. Olusegun. I hope I said your name correctly, and I think I've tried to hope I'm not butchering your name every time you're on a webinar. Does the charges for the coding be also a percentage? Also be a percentage? It can. That's how I was explaining it to you. I just knew one of the doctors that I was doing billing for was a urologist. And I knew that there were going to be times that he had special procedures and also did some surgical procedures in his office. So I left enough bandwidth in my percentage that I was charging him to say, you know what, if you do 2 to 3 where I need a professional coder, I've kind of got that already baked into my percentage. If he never used it, great. I still had the money there. If I had to use it, then I would just use CodeWright services and then just let that go. Now, again, if it's heavy, I'd say no. Like, look, if you're going to do a lot of where you're going to need to use a lot of my coders, and that's the way I place it. If you're going to be using a lot heavy usage of my coders, then doctor, I'm going to have to charge you for the coding procedures, okay? Because we want to make sure they get done right. So that's the way we do that. All right. So again, what I just shared with you is kind of the basic. We kind of went through the revenue cycle management part of it. Thank you for the thumbs up. Appreciate that. We went through the basics there. You kind of know the basics. There's diagnosis codes. There's procedure codes. In most cases, it's always going to be the doctor's responsibility getting those to you. So don't fret this whole thing about coding. But then you always have a safety net with CodeWright if you need it. Now, ABS is here to train you. So what I'm going to be doing for you right now, I'm loving several thumbs up here. Appreciate it. So what I want to share with you now is our training overview. Now, this is going to be kind of animated. So if you want to wait to the last part of it and take a big screenshot of this, you can. But I'm going to share with you what you're going to go through. So there's 10 modules that you're going to go through in our training. Now, this will take you approximately 2 weeks. It could be done a little bit shorter, but I wouldn't try to rush through it. But typically 2 to 3 weeks, you should be able to finish these 10 modules. Because in between each module is a session with a live trainer, just like what we're doing right now through Zoom webinar. There'll be a Zoom meeting, but instead of your microphones all being turned off and you're having to communicate with me through the Q&A box, your microphone will be open to have that one-on-one discussion with your trainer. So, but at the end of each of these modules, though, you're going to have some work to do in between those. That's why I said, it could take you 10 days to get it done, but still you need to leave a little bit of room for this. So let's go through module 1. And then once I kind of showed this overview, then we're going to dive into some little bit deeper areas. And if we've got the time, I'll hopefully be able to get through everything this afternoon. So first of all, module 1 is obviously just the introduction. We're going to be working you through what's called the practice workflow. What is it? What does the office look like? What's the services look like within a practice? And then introduction to medical billing. So some of the things that I just shared with you just now, you'll recognize. So that information will go through it. Second module is iClaim, EMRX overview, and then the iClaim and EMRX pricing. Now, again, your pricing is what you're going to charge the doctor for the use of these services. Now, this is separate from what you're going to charge a doctor for your services, your actual percentages. But with every billing system out there, and now it's pretty much almost 100%, everything out there is subscription based, okay? So the doctors are currently using some type of billing system. Now, in the beginning, they may not want to change, and that is A-okay. I just want to let you know that. You do not have to switch a doctor to use iClaim and EMRX. However, it is always beneficial to let the doctors know that you have a billing platform that you prefer to use. However, if they're not ready for it in the beginning, it's okay. Because over a period of time, we're going to show you how to get them to switch over to that, because obviously it's going to make your billing a little bit easier. But we're going to go over the pricing for you on that. Number 3, We do have a dental billing system for those that want to differentiate between medical billing and dental billing. That is really two separate types of codes. I have never done dental billing. I've done medical billing but in the past. I don't do dental billing. I never have. Don't think I really want to. But there are some who have asked for that in the past. And so we're going to teach you and train you how to use the DentaMax system. Then we're going to get into some of the money of how to help the doctor recoup money that's outside of the insurance area. Because, folks, some people need to pay by, some people are cash pay patients. Some need to extend their deductible payment out over a period of time. So that's why we've got choice pay. It kind of helps extend that out a little bit in payments, and it reminds the patient to make that payment, especially if they're using iClaim. There's actually a payment plan within inside of iClaim called choice pay. And then quick collect is for those patients that do owe the doctor money. And instead of sending them to a collection agency, we go them through Quick Collect, and then we kind of make a payment process through that. So that's what Quick Collect is all about. Module 4 is now getting into some more of the codes. So Audit Guard and CodeWrite are actually the same service of group of people running two separate services. Audit Guard, I liked that one because whenever I started a new doctor, I would actually begin with Audit Guard, because this is what I would tell the doctors. I'm about to take over your billing from a previous biller that you had in-house or a previous biller that you had outsourced. What I'd like to do, can we review a few of your charts, maybe 20 to 25, maybe 30 charts? I want to get that reviewed through our certified professional coders. It's going to run you about $1,500, doctor, but what it's going to do is going to give us a clean snapshot of right where you are. Most of my doctors went for that because they knew that they could be leaving money on the table. The other thing it'll show is if they're overcoding, and it puts them in a position for clawback money. So really what Audit Guard will do, it'll kind of help recalibrate that doctor where they need to be on their coding and how they chart their notes, okay? CodeWrite, we've already kind of gone over that. And then we're going to start talking to you about HIPAA compliancy. So every doctor needs HIPAA compliancy. There are so many things that can cause issues within a doctor's office about HIPAA compliancy, and we'll go over all of that. Module 5, we're going to talk about AutoCard. Doctor, and this is a greeting card type of service that will go out automatically that you can set up for doctors so that they can remind their patients for, guess what, annual wellness visits or annual physicals or whatever you want to call those. For women, it may be the mammogram reminders that are out there. So you've got different things, or just simply happy birthday, just a reminder from our office. We want to wish you happy birthday, and it's a signed card from the doctor. AutoCard can process that. It's a way to help increase doctors' connection with their patients. Credentials now have to do with the credentialing. When a doctor wants to start with a new insurance company like Aetna or Cigna or Blue Cross Blue Shield, they have to go through what's called a credentialing process. At one point, we did not have that. We have it now, which is wonderful, because really what happens is you become the one-stop shop, everything needed for that doctor. Doctables is a way to help the doctor save all of their things that they need. And then there's obviously a review of basically modules 1 through 5. Starting with module 6, this is where everything over here on what you're seeing on the left side of your screen there is having to deal with just the basic business of all the things that you have to provide. Now, starting on module 6 is where we're going to start getting in everything, how you're going to get your clients. So you can see we get all of your basic training out of the way, because the end of week 2 and the beginning of week 2, middle part of end of week 2, we got to get you ready and prepared to start getting your clients. Because even the rest of that's over here on the left-hand side, modules 1 through 5, you're still going to need some training on. We have a complete training website that you can go to after your live training. So if you need refresher courses on any of this stuff, we have it out there. on our ABS LSS site. But Introduction to Marketing, More Marketing, Module 7 has to do with this business networking, how to use the books as marketing tools, ebooks that we have for you. Matter of fact, those ebooks are really good for what we kind of call your first tier doctors. Some of your first tier doctors may be physical therapists, occupational therapists, licensed social workers, chiropractors, massage therapists. I mean, right there, there's 5 right there. And so we've got what we kind of call um, client magnet type of ebooks to kind of help zero in. And we're going to show you how to utilize all that. Marketing sales reps, marketing with sales reps. If you want to use a sales rep, how to find them, how to hire them, how to get referral partnerships out of them. That's one of the best ways to do it. That's how I got my first couple of clients. I did some referral processes with some sales reps and just paid them a small little, finder's fee for that, and that was very helpful. Marketing via classified ads, lead management. So we're going to show you how to do that. Matter of fact, Adam has just added a CRM to your package for 1 year through Zoho. So you're going to have your lead management, follow-up processes, everything built in. So you don't have to go figure out which CRM you want to use. We've already got kind of baked in and ready to teach you how to use that. Module 9 is how to use the practice analysis and how to use the practice analysis results. So again, when you're starting with a doctor, you finally got invited to talk to the doctor. You're going to take them through what's called a practice analysis. We're going to go over that with you. It's non-salesy. It is very much consultative. And then once you put the results together, and you're going to show you how to utilize that with the agreement. And then lastly, presenting the proposal, the demonstration that's required, that might be requested. That is the demonstration of the iClaim system. So that's why it's important for you now to get with your sales rep and set up a time where you can see how the system works currently right now. Okay. All right, so we've gotten through a bulk of this. So any particular questions? I know probably right now you feel like you're drinking out of a fire hydrant, and the next part of it's not going to slow down. So we've got, just about 25 more minutes before the top of the hour. Chad's asking, does the training cover how to do accounting in your business like QuickBooks? Yes, that is touched on. So the great thing about it, even though it's not listed here in any of the modules, anything that comes up with your trainer, let me tell you, the trainer is superb. She has been with American Business Systems for years as a business owner. She had the heart for teaching and sharing because, so much was given to her through the training, and she learned it, that she wanted to become one of our trainers. She became one of our trainers. And sometimes we use multiple trainers, but they've been there, done that. So you're not learning from someone who's been saying, hey, will you teach this book, even though you've never done medical billing before, which happens with a lot of different types of companies. All of our trainers either are currently doing their medical billing practices still, or they have, and they're just kind of semi-retired and they're doing this for us now. Okay. So Chad, yes, that will be answered during your training. All right, just a little bit deeper on some of these module prospects or modules here. So when we're getting into business setup, so this is what we're going to cover in the business setup. So we're going to use the complete setup of your entity. Do I use a LLC? Do I use a sole proprietor? We're going to get into all of that information with you during that time. We're actually going to set you up and show you how to virtually set up your company. Obviously, using a business address and a phone number. All of you will probably want to do this business from your home. Listen, since COVID, it doesn't matter where you're doing the business. The doctors already know that you're probably working from home. So it's not that they have to go to an office. Like in the old days, if you didn't have a brick and mortar place, you're really not in business. Who would ever want to work from home? It's just the opposite now. Who would ever want to have a brick and mortar and the expenses that go with that? I mean, if you got a spare bedroom, you can turn it into an office. I mean, you're rocking and rolling. We're going to show you how to get some logo designs, how to get your professional website through our templates set up, get the forms that need to be filled out. That goes directly to your email account, so you'll have that, and then the appropriate CRM and accounting software. There you go for your business, right there, Chad. That you were asking. That's one of the first things we're going to do. Number two. So there's 10 of these I'm going to go through. So again, if you want to take a quick screenshot of this, I'll give you about 2 to 3 more seconds if you want to do that. If you're not prepared to do that, please don't concern yourself. If you'd like to get a copy of this in a PDF, simply ask your sales rep. We'll happily turn all this into a PDF so you can have. All right. Number two, now we're going to start getting into medical industry knowledge. This is just some of the things that we've already kind of talked about. What is revenue cycle management? What are diagnosis codes versus procedure codes? We're going to address some of the revenue challenges that doctors are faced with in medical practices. Obviously, we're going to cover all the HIPAA compliancy that you're going to need through Compliancy Guard. We're going to, obviously, you saw it already there, right there. We're understanding the revenue cycle. You kind of got a little bit of taste of that today, and teach you how solutions for accounts receivable problems, how to get this money back into the practice that doctors can't seem to break through, and they want to get that money that's owed them. If they've done the work, they need to get paid. So we're going to show you how to do that. So that's the medical industry knowledge. So just think of that as just kind of looking over the landscape of everything that goes on and the doctors are facing. The practical technical training. Now, this is when we're actually getting into insurance claim challenges and some solutions, and then the difference between what is an outsource, what does an outsourced company do versus an in-house biller, okay? And why is it better for a doctor to get that out? We're going to explain all that to you. Now, I've explained that to some of you who've maybe been on some webinars where I've kind of gone into some depths on that, but that's okay. We're going to help you chart all that through. The importance of eligibility verification. That's that part where I was telling you about in the very beginning. Let's make sure that if that person is using Blue Cross and Blue Shield, that is actually eligible to receive benefits for that patient. Sometimes patients are using outdated cards, and sometimes people put that in their system only to produce claims that get rejected. So, and then we're going to teach you about appointment reminders within the system to how to get all that set up. So that's the practical, technical training that you're going to be getting to. Now we're going to start looking at your different revenue streams. Again, if you want to do dental billing, there's a revenue stream for you. Now, again, medical billing and dental billing are two separate things. And I even want to split out one more part of medical billing. Some of you may or may not know this, but even in the medical billing side, there's what's called the professional billing and the institutional or the facility billing, okay? So professional billing is for doctors. Those are your primary care physicians, internal medicines, all your specialists, cardiologists, podiatrists, all of the different specialists, massage therapists, chiropractors, anything to do with healthcare as a provider is what's called a professional billing. Anything that's in institutional or facility billing, that's a different type of a billing. That's going to be more of your home health. I mean, not your home health, but your skilled nursing facilities, rehab facilities, your hospitals. So the difference is with the professional billing, they're going to bill on what's called a CMS 1500. So CMS, Charlie, Mary, Sam, okay? CMS 1500, that's what's inside of iClaim, okay? That's where you're going to put the patient's name, the procedure codes, the diagnosis codes. That's the form that you fill out. For hospital and facility billing, that's called a UB04, and there is a ton of information. So we don't teach that here, okay? Now, it doesn't mean that some of our billers haven't become UB04 billers, because they've advanced to that. So that's the healthcare side. Then I said again, you got dental billing, which is completely different from healthcare billing. So here's my suggestion: stick with the CMS 1500, folks. Okay, that's your professional billers billing part of it. That's where you're going to get. That's the cream of the crop. That's probably where 95% of all of our business owners stay within it. And so get 2 to 3 of those, and you'll be happy as a lark. We're going to show you how to work with doctors who want to remotely manage their patients. When I say remotely manage their patients, this is called virtual care. So if a doctor would like to remote manage a person's blood pressure readings, or their weight, or their glucometer, or for monitoring blood sugar or anything else like that, we have a specialized service called virtual care. It can become a practice profit center, because the doctors aren't having to bring that patient in and then see that patient and make room on the schedule. It's all done virtually. Again, that's the teaching how remote patient monitoring services work. Quick collect and accounts receivables, kind of all talked about that. But these are just the different revenue streams that what you can make. You can make money on each one of these, as long as, and the doctors can do that as well. So this is some really good part of it. Again, here are some of these services that I talked about: DentaMax, Virtual Care, Quick Collect, Choice Pay, Audit Guard, and CodeWrite. Okay, so each of these services are revenue streams for you. Some of it's even revenue streams for the doctor, but these are just the example flyers that you're going to be getting. All of these are an 8.5 by 11 on heavy cardstock, glossy type of paper there. You're going to get this in your initial package. Once you start with us here at American Business Systems, you'll get this welcome package, and all of that will be in there for you. All right, compliance expertise. Again, Medicare audits happen. Not only Medicare audits happen, Cigna audits happen. So many things happen with those doctors whenever it comes to potential audits that would happen for those doctors. We're going to teach you how to, navigate through the compliancy guard. That's the HIPAA part of it. Help doctors prepare for regulatory audits that could just pop in on them. But all we're doing is positioning you as the compliancy expert to your clients, and that's through HIPAA or through Compliancy Guard. And so that's the compliancy expertise. I got to rush through some of these, so forgive me. It's about 15 minutes to the top of the hour, so let me try to get through these last 4 here. And these are some of the important parts, because you can see that first 1 through 5 is kind of what I went in detail with on what I shared with you on that big screen there, or that one slide there. This is kind of more granular of what you're going to be learning. So the marketing and patient retention, we're going to cover auto card. This is patient retention for the doctors. Credentials Now, again, that's the credentialing, and you can use that as a marketing tool that you do credentialing for doctors. We're going to teach you how to review, teaches online review of management for medical practices, the implementation of patient engagement through Doctable, and then any cost-saving services during the training. So here are the slides for that. AutoCard, Credentials Now. You will be a credentialing service to your doctors, okay? All right, business development strategies. This is number 7. Define your target market with precision. Who do you want to go after? You want to go after private practices, primary care, internal meds? Do you want to target a specialty? My recommendation is just get somebody underneath your belt at the beginning. Some of those can be your nurse practitioners. You can work with physical therapists. They always need a biller. Licensed social workers, they need it. Those that are in the medical part of mental health care services. Those folks need help. They do their own billing as well. We're going to teach you how to treat yourself and position yourself as the expert out there in the marketplace. We're going to show you how to use the practice analysis questionnaire and the templates that we already have built for you. And we're going to teach you how to get referrals. We're also going to show you how to co-brand your books. Now, I'm going to show that to you just real quickly. This is one of the books that you'll be able to co-brand for yourself. This book was done by our founder, Patrick Phillips, and again by Dr. Vicki Ratner. It's about a 275-page book. It's called The New Thriving Medical Practice, and it's really dealing exactly some of the big issues with doctors. Now, here's where we get to co-brand it with you. You will be the person who wrote the foreword to the book. These are printed on demand, so your name will go right below the two authors there, Patrick and Vicky, Dr. Vicky. And we already have a templated forward for you to utilize. Now, again, you may choose to write your own, and that's okay. Just let us help you through support. We'll make sure that you've got the right things that need to be said there, so you can add your personal touch to it. But then your information goes into the written part of the book, so it shows the forwarded that's written by you, certified medical revenue manager. Number 8, networking, getting that networking out there and start lead generation. That's the biggest thing that you'll want to start. Like I said, we got to go through all the initial, your essential things that you're going to need to learn about your business, but now getting the business. And that's where we're going to teach you how to find power partners out there in amongst your folks. Your community, in networking meetings. This is again how I found my first doctor. I did not find my first doctor by knocking on one single door. It was through partnerships in the healthcare industry, and there are a lot of people out there, and there are a lot of meetup groups within the healthcare industry. Home health groups meet, physical therapist groups meet. Social workers meet. I mean, and then sometimes they all meet all together at one place. And then when you start to find out some of those areas there, it's going to start to expand. And so some of those people already know doctors. So a warm invitation from somebody like that will certainly help you get your first doctor very quickly. Getting your number 9, getting client acquisition. Now we're going to start to show you how to do sales representative recruitment and management of those folks. If you want to build a sales team, we're going to show you how to be able to do that. We're going to show you how to use classified ads to find your staff. We're actually going to show you, this is not on here, but we're going to show you how to use classified ads to even find a doctor who's looking for a biller. Clever ideas here. We're going to show you how to cover some lead management and follow-up systems utilizing Zoho. So we're going to teach you how to do that, how to do even some direct mail campaign strategies that we have built for you for doctors. And then finally, number 10, getting the doctor onboarded. So we're going to help you with everything that you need. So what you've got thrown at you this afternoon is truly soups to nuts, as they would say. Your proposal development and presentation, all of your pricing strategies of what you got for that doctor, and then providing implementation procedures. We're going to help you walk you through whether you are converting that doctor from their current billing system and moving them over to iClaim, or us teaching you how to actually use what the doctors are currently using as their billing platform right now. So we'll help you every step of the way. Okay. All righty, folks, it is about 8 minutes till the top of the hour. There's a couple of frequently asked questions that we typically get asked during this time. And I'm going to go through these, but if you've got any additional questions, now's a good time to put those in there. So the first question is, how long do I have access to the course? Well, you actually have a lifetime access to the course. On special occasions, if you need to stop and pause your training, it's not like, oh, well, sorry, you can't do any more. You've expired your training course. We never do that. We'd have never done that to anybody. So you've got a lifetime of access. So if you get through about halfway through the course and you say, you know what, some things have come up and I need to just put it on hold for at least 30 days. Can I pick it back up? Of course, we'll work with you on that. So don't worry about that at all. When does the course start and finish? Well, the course starts as soon as you get your paperwork in and turn it in, and you schedule it with your sales rep. There's a course that starts just about every single week. It just doesn't end. If you need additional training on anything, that's through our ABS LSS site. So if you've got some modules that you need some refresher courses on, just go at your own pace through the courses that are already there. So we can certainly help you with that. And then lastly, what if I'm not happy with the course? Well, folks, there is no other organization out there in a business opportunity or a franchise opportunity that would do this. So we know that partly what you're doing is learning about us virtually, okay? You've met with your sales rep, you've met with me through the webinars, you've probably heard Adam and Jason and some others on here. You've heard of other business owners that we've had here. But if through that training 10 modules, if you feel like at the end of that, this is just not for you, we have a 100% money back guarantee that if you don't like it, ask for your money back. But you do have 30 days. Now, the 30 days starts on your first day of training. So it doesn't start the day that you sign your agreement, because you may not get started your training until about a week or two after you've done that. So if you think about it, we do give a little bit of grace, and we grace it on the side of when you actually start the training. So for 30 days after you start the first module, you've got 30 days to decide whether this is the right business for you. So what can you lose? ABS knows that we take a risk that anybody along the way could just say, no, this is not right for me. And we do and have reimbursed people their money back.